Zostavax is a product that we use to prevent shingles. And depending on if your insurance covers it or not, the cash price is over $200. Oftentimes insurance will cover it. I'd recommend anyone who is of age to get shingles. If you've ever had shingles you wish you would have had the shingle shot. The shingle shot isn't 100% effective, but it certainly can decrease the severity and the duration of a shingles attack. The shingle shot is a one-time vaccination, and it is usually recommended for people over 60, but now they are recommending people 50 and over can get a vaccination of the shingle shot. It requires a prescription from your physician, and it can be given at the pharmacy if we have a prescription. Well, every insurance is different, so you would it would probably be best to maybe contact your insurance company first to see how your insurance covers the shingle shot, so you won't be surprised. But it won't be much over $200 if you have to pay cash. Okay, over-the-counter pain relievers that are available. Of course, aspirin's been around forever. There's acetaminophen or Tylenol. And then there's the non-steroidal anti-inflammatories like ibuprofen and naproxen. Some of the brand names are Motrin and Aleve and Advil. Aspirin is used therapeutically more now, not so much as a pain reliever, but we'll use it for preventing blood clots, to prevent heart attacks and strokes. So doctors will prescribe that therapeutically, but we don't see it used much for pain anymore. We go mostly with the acetaminophen or Tylenol products, or the ibuprofen and or Motrin products. Acetaminophen or Tylenol is a good pain reliever, fever reducer. It has its own side effects, though. We have to limit how much acetaminophen you can take in a day to 3,000 milligrams. It potentially can cause liver toxicity, so we have to be careful how much acetaminophen we take in a day. Ibuprofen or Motrin and Aleve and naproxen, they're good anti-inflammatory pain relievers. They are also good fever reducers. Aspirin's kind of fallen out of favor because it has side effects, and for example, it can interact with blood thinners, and it often is used therapeutically with blood thinners, but it can cause bleeding tendencies, and it can irritate your stomach, and you can develop ulcers. As can with the ibuprofen and Advil type products, those also can cause gastric irritation, and we have to monitor for those type of side effects with those type of medications. Ibuprofen and Motrin type products often take several days for the anti-inflammatory effect to take effect. You might get some pain relief within the first dose or two, but the anti-inflammatory effect may take several days to kick in, and it may take higher doses. Then at higher doses, you're predisposing yourself to more side effects. And so if you have to take an anti-inflammatory pain reliever, it's always a good idea to get some expert advice from your medical provider. It's always good to ask your pharmacist when you're dealing with pain medications. There are cautions on the back of the box, but people don't always review package information, so it's always good to ask your pharmacist, get to know your pharmacist and utilize them. That's what we're here for. So it's always good to get all the information and be educated about the medication you take. So just because these products are over the counter doesn't mean they're 100% safe. In fact, ibuprofen and Aleve were prescription drugs when I first started in pharmacy, and so they became available over the counter. So they do have their side effects that we need to monitor. Over the counter, there's a lot of multi-symptom products available. You have to be careful and look at the ingredient list. It's very possible to duplicate medication. If you're taking something for a cold, it may already have ibuprofen in it or a Tylenol in it, and then you add another Tylenol product to it or another ibuprofen product, then you're duplicating and increasing your chances of overdose. So you have to watch the labels. Well, the community pharmacist has a very important role in helping a chronic pain patient. First of all, we're responsible for filling prescriptions accurately. Second of all, we are it's very important for us to educate the patient on their pain medication. A well-educated patient will have less tendencies to run into problems in the future if they know what their medication is, how to take it, and some precautions of use. The third thing that we do is we monitor the patient's therapy. We do that by using drug utilization programs on our computer, where we can see if a patient is overutilizing their medication or underutilizing their medication. And another tool that we have access to is the South Dakota Prescription Drug Monitoring Program, which is a program that became available in the last few years. It helps us identify patients who may be using multiple pharmacies and multiple doctors trying to obtain controlled substances. It helps us maybe prevent a problem for that patient and maybe stop a problem from continuing. The South Dakota Drug Monitoring Program, I think, is a very important program, particularly for the providers and the pharmacists. The provider can look at that program and see right away if a patient is doctor shopping and trying to obtain medication, maybe for a use that's not legitimate. So it's very important, and we can kind of get the problem stopped at the start. And I think the problem patients are beginning to know that that system is out there, and I think it's going to help. The opioid pain relievers have a tendency to cause tolerance, which means that you have to take more medication to get the same effect for the pain relief. At the same time, you get taking more, it increases your chances of dependence and addiction, and increases your chances of drug side effects. The opioid analgesics can cause respiratory depression. So if you overdose on opioid analgesic like hydrocodone or Oxycontin, you stop breathing. The CDC says opioid medication overdoses is at an epidemic level. So it's critical that we educate patients about misuse and abuse of these narcotic pain relievers. There's a lot of people being hurt and dying because of misuse and abuse. The other issue with these opioid type analgesics is misuse and diversion. There's a black market out there in the world. So a lot of non-legitimate prescriptions get filled and then get sold on the black market. It's something that we don't feel very good about as pharmacists, because we are only here to help our patients, and sometimes we just don't want that happening. So it's very important for us to be monitoring appropriate drug use, and I think these programs of like the South Dakota Drug Monitoring Program are going to be very helpful for that.